if I traded it all.
My next guest has been on with me before. I have with me Gunther Mueller, and he is the Vibrant Health Guru. Did anyone know that February is Heart Awareness Month? Welcome to the show. You got to tell everybody a little bit about yourself. What's going on with February? All hearts all over the place. We just had Valentine's Day yesterday. Welcome back to the show. So tell everybody a little bit about yourself.
Hi, Carol. Good to be back. Thanks so much for having me on the show here. And okay, so we're in February. This is Heart Health Awareness Month. Heart disease, cardiovascular disease, #1 killer of both men and women in the United States. Everybody thinks it's just for men, and everybody kind of thinks that breast cancer is the #1 killer for women. That's not true. It is still heart disease for women. And the risk for heart disease in women exponentially goes up postmenopausally. And I think on the last show we touched on premenopause, postmenopause a little bit. Estrogen, testosterone, progesterone, thyroid, vitamin D3. These are all hormones. Even though they call it vitamin D3, it's a hormone. It's the sunshine hormone. It is, if you were to be totally naked in the sun for like 20 minutes, you could produce like 20,000 IU of vitamin D3, but we don't do that, right? We put sunscreen on our skin, so we block out that UVB production. Most Americans are vitamin D3 deficient. And the range, this is the one thing I want to share with the listeners again, is when you look at your lab slip, right? I want you to know that the right side of that lab report is just a reference range. It's an expected range. There is no science behind that range. It's the average of a population. So when you get your lab work done and you're 40, 50, 60 years old, that reference range is adjusted to your age. It's the expectation of where someone your age should be. So the range for vitamin D3 is anywhere between 20 and 100. And so what I want listeners to do is ask themselves, where would they like to be? I can tell you what the medical literature says. And at Get Well Scottsdale, this is what we practice. We practice what's called evidence-based medicine, meaning there is medical literature and medical studies from all over the world, from Australia, from France, from England, of course, from the United States. And your doctor that you've been seeing, and they're all good people. They all got into medicine. They went through the training to help people, right? But even the best physician does not know what they don't know. And if they don't know, they can't help you, they can't treat you, right? So we'll get into the symptoms in a little bit, but when you have a D3 level that is in the 20, 25 range or 30, which is typical for the American population, most people that get their lab work done have a D3 level around 20, 25. The medical literature says that you have a 50% increased risk of all types of cancer if your D3 level is below 50.
So what you're saying is that your hormones can affect you in almost any area. If you think it's just your hot flashes for women or for menopause for men,
yes,
it's way more than that.
Way more than that. I can tie every symptom, I can tie almost every medical condition to either a hormonal deficiency or a nutritional deficiency. And what folks need to understand, hormones are not just hormones. I'm talking about bioidentical hormones. I'm talking about human identical hormones, meaning the same molecular structure of hormone that the ovaries and the testes have been producing all of your life, that's the molecular structure that your body needs. If you give your body anything other than that, you create the potential for side effects, for negative side effects. And that's what happened a lot in women's health. Women were taking Premarin. They were taking Provera, which is synthetic progesterone. It's not human identical progesterone. But I guarantee, I've worked with over 250 doctors in this country, and for 90% of them, I can ask them, what's the difference between progesterone and a progestin? And they'll say, oh, it's the same thing.
I didn't know it was different.
It's different. So what's in birth control pills these days, that is synthetic progesterone, is a progestin. So most women that get on birth control, they could be on birth control for 10, 15, 20, 25 years of their life, right? Mm-hmm. And then they get off birth control and they want to conceive and they have issues. This
happened to me, guys.
Yeah, this is a big deal, right? So infertility, PCOS, PMS, right? How do you solve these things? This is what we do at Get Well Scottsdale. And it is based on global medical literature that most physicians do not have the time to review, because they don't get taught it in medical school. So when you talk about heart attacks, heart failure, the #1 killer of both men and women in this country, What are we going to do about that? What are we going to do about preventing a heart attack? What are we going to do about preventing breast cancer? What are we going to do about preventing bone loss or osteoporosis, osteopenia? What are we going to do to prevent prostate cancer? Right? What are we going to do to prevent Alzheimer's disease?
Well, I think what's really important is that people should take charge of their own health. Right?
Yes,
and the way they can do that, first of all, I think reading this book would be great because there's a ton of information in there about, yes, heart attacks, heart failure, and diabetes, but also how, hormones can actually affect all of that, and you can actually get a heart attack from having a hormonal imbalance. So we're going to open up the lines to the audience if it's okay with you. We're going to give the book to everyone.
Yes.
Free to everyone. So our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Get Well Scottsdale. They're located in Scottsdale. Their phone number, you can call them. They love to talk to you. They would love it. The number to call is 480-607-6503. Their website is Thyroid Doctor, doctor spelled out, Arizona spelled out.com. So Thyroid Doctor, Arizona.com. Or call in here, get the book. Start off with that. People are listening right now, especially a lot of men right now that are dealing. You said that number one for men to get is a heart attack.
Yes.
And you're listening to this. Get the book. Start with that. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. I want to talk about symptoms for men in with the thyroid problem.
So men don't feel thyroid as much as women. So women really feel thyroid optimization a lot. Men feel testosterone. So both thyroid and testosterone are those hormones that you feel. You don't really feel estrogen. You don't really feel progesterone, although progesterone can help women sleep a little bit better at night. You don't really feel vitamin D3, right? So when we're talking about symptoms, those feel-good hormones are really testosterone and thyroid. And so what symptoms are we talking about? The number one symptom that most patients come to see the doctor for is fatigue. Doc, I have no energy. I can't make it through the day. I got to go to Starbucks at 2 o'clock in the afternoon. I need a 5-hour energy shot, a Red Bull, or something like that. I'm dead. I don't sleep well at night. 60% of Americans do not sleep through the night. They're waking up at 2, 3 o'clock in the morning, can't get back to sleep. That's not natural. You should be able to sleep through the night. And at Get Well Scottsdale, we know how to fix that. Depression. We're becoming the Prozac nation in this country. And I can tell you that you do not have a Prozac deficiency. If you can't sleep at night, you don't have an Ambien deficiency. You don't have a Wellbutrin deficiency. You have a hormonal or a nutritional deficiency that when we look at the root cause through extensive lab work, through spending an hour, hour and a half with you, asking you about your diet, your lifestyle, your habits, your family history, and really getting understanding of who you are, identifying the root cause as to why the body is expressing itself with these undesirable symptoms is what our practitioners do at Get Well Scottsdale.
You can call them direct. Their phone number is 480-607-6503. Their website, again, it's Thyroid Doctor, all spelled out, Arizona's all spelled out.com. Or call in here. I'm giving a book away. I'm going to do it throughout the rest of the show for everybody. It's heart attacks, heart failure, and diabetes. It's prevention and treatment, but also how hormones affect that and could be causing it. Our number here, 602-277-5369. Toll free, it's 1-866-536-1100. We have a couple minutes before we go to a break, okay? And it's Heart Awareness Month. It's February. And people love their significant other. Someone that's sitting here listening and maybe their loved one they're dealing with issues, what would you tell them to do?
I'd say you need to do everything in your power to get them to a provider that looks at the world through a different lens. Because most of our patients that come to us have been 10 to 15 different doctors, and they've heard the same thing, doctor after doctor after doctor. Hey, your lab work is normal. I don't know what's really wrong with you. Maybe you're depressed. Maybe you're anxious. Here, we'll give you a prescription for this or that. And I'm sure that your listeners are hearing this right now and saying, that's me, right? And if you're saying that, you're saying, that's me. I've been from doctor to doctor to doctor, and I can't seem to find out what's wrong with me. And if you have ever had that intuition that it's your thyroid, I'm telling you, you're right, okay? A good physician listens to their patients.
And that's what they do over there. You said that you would spend an hour and a half with them. Again, that number to call them direct, it's 480-607-6503. Call here and get this book. I mean, it starts with that. Get some answers through there and then call them direct. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. We're going to go to a break. When we come back, we want to talk further. Hang tight. We'll be back in just a minute.
If I traded it all.
Welcome back, everyone. We're talking with Gunther Mueller, and he's the Vibrant Health Guru. And I got to tell everybody why you call yourself that.
Well, my experience has been that over the last 7 years, I have really worked with physicians side by side in helping them and educating them on hormone optimization, nutritional optimization. And so, I've been in this unique position where I've gotten to spend time with these doctors and understand how they approach medicine, understand how they practice. And, my takeaway from that years of experience is that these are good people, okay, and they really do want to help their patients. They went through medical school. They went through all that time. And unfortunately, in medical school, we have big pharmaceutical companies that are kind of influencing the training that happens in medical school. So what's happening is a lot of doctors are coming out of school and there's a pill for every symptom. There's some synthetic drug for every symptom. Now, I don't want to take away from Western medicine. If I was in a car accident today and I wound up in the emergency room, I would be like, give me all your skills, give me all your drugs, make me feel good, put me back together, right? But what I'm talking about is the fact that the average senior citizen in this country now is on about 20 different prescription drugs.
It's sad. But here's the thing, though, what I know more than anything. It used to be very different, but now, today, everybody's reaching for something a little different, more healthy,
yes,
more organic, or more natural.
Yes.
And obviously, you have different modalities at Get Well Scottsdale. Tell everybody a little bit about some of those modalities.
Well, we do things like IV nutrition, right? So when you're taking supplements through the gut, most people have gut issues. 4 to 5 pounds of your body weight is bacteria in your gut, right? There's a flora and fauna there that needs to be balanced properly. There's different pH in the beginning of the system as there at the end of the system, right? And I'll tell you this, 1 round of antibiotics, if anybody that's listening has taken antibiotics, it can wipe out your flora and fauna in your gut for up to 7 years.
Wow.
So if you're not taking proper probiotics after a round of antibiotics, you can have serious issues, gastrointestinal issues, leaky gut syndrome, all these different things. So even though you're eating food, you may not be absorbing the nutrition from that food. And if you spend 1, 2, 5, 10 years of your life not absorbing the nutrition from that which you're eating, you're going to wind up with issues. Right?
Now, we've got our lines open here for the heart attack, heart failure, and diabetes book.
Yes.
That we're giving away.
Yes.
And it's free to everybody out there. So all you have to do is call in here, get the book. This is good information and how this all ties in together.
Yes.
Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. It's Heart Awareness Month. It's Valentine's Day was yesterday. It's still, as far as I'm concerned, it still is, because the weekend, everybody knows that if it was yesterday, the whole weekend we're going to be celebrating. But let's celebrate by how we can get each other better, feeling better, and
yes,
also how to prevent all of this. The number to call here for the book is 602-277-5369. You can check them out on their website. It's thyroiddoctorarizona.com, and it's all spelled out. Go ahead.
So I want to tell folks about the book and why it's so important. What you're going to get out of reading this book, and it's short, it's very manageable, it's not hard to read. The gist of this book that Dr. Mark Starr wrote was how to have a 90% improvement or a 90% decrease in the incident of heart attacks and cardiovascular events. That is an astounding number. And this was done by Broda Barnes in the 1970s, who was one of Dr. Starr's mentors. And then Dr. Starr did that data and did that study again in the 1990s and proved it out again. And everything in the book is compared to what's called the Framingham study that happened in Framingham, Massachusetts, where they took a population of 1,500 people. They've been tracking them for their lifetimes, and they know what cardiovascular events are going to happen. How many heart attacks, how many strokes, right? How many aneurysms and things like that. Well, Broda Barnes and Dr. Mark Starr, both in their 1,500, each one of them had about 1,500 patients on thyroid, and with thyroid optimization had a 90% prevention of heart attacks and strokes.
Call in here for the book. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. You could call them direct. They will talk to you and they'll help you. Their phone number is 480-607-6503. Their website is thyroiddoctorarizona.com. You know, it's interesting because a lot of people out there they don't realize that their hormones affects everything.
It does.
Okay.
And in heart health especially, and now in women, right, female physiology, the hormone that is missed a lot is testosterone.
In women?
In women.
Okay, there you go.
So the ovaries produce testosterone. A lot of women think that that's just a male sex hormone. It is not. Women actually produce more testosterone in a lifetime than they do estrogen.
That's why we got hair on our face.
Exactly.
Go ahead.
Exactly. That is one of the reasons, right? So the heart has more testosterone receptors than any other organ in the body. Testosterone is a vasodilator. It opens up your blood vessels. When you open your blood vessels, you have more blood flow, more oxygen, more nutrition to where? To your brain, to your heart muscle, right? To every organ in the body, your liver, your kidneys. So by checking your testosterone, and women need a heck of a lot less than men, right? So a man's testosterone level is about 100 times that of a female. But women need some. And what happens, the ovary ages from the inside out. And testosterone is produced in the inner core of the ovary. So testosterone is the first hormone that women lose, and they lose it between the age of 20 and 40 at about 50% a year. Then progesterone is the next hormone to go.
You should call in here for the book. Start with that. It's free from me, 602-277-5369. One thing that you talked about the last time you were on, and I think it's important for us women to know, because I asked you this question, which was, I'm 60, so I've been through what I think I'm done with menopause, but you said that's not the case, that you still have issues. Go ahead.
I was saying the ovary is aging from the inside out. On the outside, it's producing estrogen. So what is menopause? Menopause is the ceasing of estrogen production, the ceasing of your cycles, right? So you've lost testosterone, you've lost progesterone, and now you're losing estrogen. The incidence of heart disease goes from 1 in 7 to 1 in 3 postmenopausally. If you do not optimize your estrogen. Estrogen is responsible for over 400 functions in the female physiology. And the men that are listening too, estrogen is very important in male physiology.
Just not as much.
Just not as much, right? It's a little reversed, but men need estrogen. I always like to say estrogen is what keeps us men friendly, okay? So it's an important function. And as we age, and I think I said on the last show too, look, we didn't used to live this long. We died at 50, 55 years old, 60 years old. You were old and you were leaving the planet just 50 years ago. Plagues, infectious disease, things like that took us off the planet. Well, today, Western medicine has kept us alive a lot longer. We can replace your hip, your knees. We can give you a quadruple bypass. We can do all kinds of things to keep you alive. But our quality of life is what's failing in America. I can tell you, American healthcare is ranked 22nd out of 23 industrialized nations in the world when it comes to quality of life. It is the most expensive healthcare system in the world. We spend more money on healthcare in this country than any other country in the world, yet our quality of life does not rank.
So take charge of that. You can now, and the way to do it is by finding out information. And again, I say it all the time on my show. I love that about this show. It's information for the listener out there that's listening. Get this book. Start with that. The number here is 602-277-5369, and toll free it's 1-866-536-1100. It's Heart Awareness Month, so this book is heart attacks, heart failure, and diabetes. It's prevention and treatment of it, but it's also how this all comes full circle and how your thyroid could actually cause you to have this. So you could call them direct at 480-607-6503. Their website, again, it's thyroiddoctorarizona.com. I say call in here and get the book. If it's not for you, it's someone that you know.
Absolutely. You have a loved one. You have somebody that's been dealing with these things. I mean, we can have a whole show on statin drugs if you are on statin. There's never been a medical study. There's not one medical study that shows that statin drugs can prevent an initial heart attack.
Well, I think that people need, especially now, I think we're all reaching for something to make us feel better that we know is going to be good for us. We're tired of the doctors being the drug pushers, which
Right.
we feel like that they are. And now today it's different. Everybody's reaching for that. What would be your final words for today?
My final words are, look, prevention is the key. So in the title of that book, it's prevention and treatment. An ounce of prevention is worth a pound of cure. It is a lot less expensive to prevent disease than it is to treat disease.
They say that they'll give you an hour and a half to talk to, and which is a long time.
Yes.
They want to go over everything with you, and it's nice to have somebody like that will do that. Not every doctor will. So you could call them direct. Their phone number, it's 480-607-6503. Check them out on their website, which is thyroiddoctorarizona.com. Keep on calling here. I'm going to let you call for the next 5 minutes or so. Get the book from me. It's free. 602-277-5369. Toll free, it's 1-866-536-1100.